Good morning, Miss Amanda Hugginkiss. My name is Jill. This is Christina. We're going to be your discharge nurses today.
Hello, Jill and Christina.
Hello. We're going to read a few instructions for you since you will be going home. So the care you'll need at home would be to be careful with lifting things over 10 pounds. Be sure to wash your hands before and after each touching your wound or dressing. Have someone drive and help you at home to help for the first few weeks. Keep your house safe and clutter-free. This will make it safe for you to walk. You may need to put on long, tight socks given in the hospital while you sleep. Now the follow-up care you're going to need is, you may need to have more therapy before going home today. Or you may need a short stay in rehab or skilled nursing facility.
So this is a model.
Your doctor may ask you to make visits for checkup on your progression. Please keep these appointments.
Alright.
You may have stitches or staples, which you will need to have them taken out. Your doctor will often want to do this in 1 to 2 weeks. You may need to keep going to therapy at an outpatient clinic. Now the drugs you may need will be for help you with pain, prevent blood clots, prevent infection, and help with other problems you may have like trouble sleeping or your stools. Physical activity will be limited, so you will need to use a walker or crutches to help you walk. Follow the doctor's orders on how much weight you can put on the operated leg, and this can range from no weight bearing to full weight bearing. You may not be allowed to do certain hip movements after surgery, and these can cause the hip joint to move out of the socket. Ask your doctor what movements are safe for you. Your doctor may suggest you follow hip precautions. Do not bend your hip past 90 degrees. Take care so you don't lean forward while sitting or lying down. Keep your legs from turning in or out. Avoid crossing your legs or ankles. Avoid kneeling. Don't cross your legs at the knees for at least 8 weeks. Don't bring your knee up higher than your hip. You will be able to do more as you get stronger. Your physical therapist can talk with you about a walking program. Most often, you should limit stair climbing to 1 flight of stairs per day when you first return home. And your doctor will let you know when you can resume having sex. Once your doctor tells you that it is okay, do not put full weight on your hip joint. To keep stress off the joint, lie on your back and have your partner support his or her weight.
Okay. Some problems that could happen. Dislocation. It is important to keep from doing some movements that can cause your hip joint to move out of the socket. Ask your doctor which movements are safe from you. Your doctor may suggest the following hip precautions. Keep your legs from turning in or out. Avoid moving your operated leg backwards and out to the side. Avoid crossing your legs or ankles. Avoid taking long steps when walking. Avoid kneeling on your operated leg. If you have to kneel, then kneel on both knees so that the operated hip is not pushed back. Avoid the straddling position. Blood clots. To avoid these, your doctor may ask you to do ankle pumping exercises. Your doctor may also order blood thinning drugs or compression stockings. Lung infections. Taking deep breaths can help you keep from getting a lung infection. Take at least 10 deep breaths each hour while you are awake. Infection. Be sure to take all drugs as ordered. Other problems during or after surgery may include broken bones, nerve or blood vessel damage, bleeding, the chance of the leg not being in the same length as the other, or loosening of the prosthesis. You should notify your doctor if you're showing signs of very bad reaction. These include wheezing, chest tightness, fever, itching, bad cough, blue skin color, seizures, or swelling of the face, lips, throat, or tongue. You should go to the emergency room right away. Sudden shortness of breath or sudden onset of chest pain could be a sign that a blood clot has traveled to your lungs. You should go to the ER right away. Signs of infection. These include a fever of greater than 100.4 or higher, chills, pain with passing urine, or a wound that will not heal. Signs of a wound infection. These include swelling, redness, warmth around the wound, too much pain when touched, yellow, greenish, or bloody discharge. Foul smell coming from the cut site opens up. More pain or swelling in your hip, and if you are not feeling better in 2 to 3 days or you're feeling worse, you should call your doctor.
I am Rachel. I'm another one of the nurses doing your discharge planning today. So I have a little bit of helpful hints for you. Tell your doctor or dentist that you have had a joint replacement before you have a procedure or test. You may need to take a drug or some other precaution before your procedure or test. For sleeping, if you sleep on your side, have your operated leg on the bottom. Use a pillow between your legs to keep them from crossing. Use a pillow between the legs when rolling. If you lie on your back, put a pillow or rolled towel on either side of your operated leg. This may keep it from rolling inward or outward. For walking and moving about, if you step backwards, take small steps and start with the leg that didn't have surgery. When going up and down steps, always go with your stronger leg first. When going down the step, lead with your operated leg. Do not turn or pivot using your operated leg. Carry a small bag or purse or a fanny bag around your waist to keep things like phone numbers, a phone, notepad close by. In the bathroom, a raised toilet seat in the bathroom can help you to get up and down easier. A grab bar may also help. For bathing, a grab bar and tub bench may be helpful. Around your house, sit in higher chairs with firm cushions. It will be easier to get up and down. Avoid low chairs and those without arms. When getting up from any surface, push up on the chair, bed, or toilet seat. Then grab your walker when you are standing. Pulling up on the walker may cause it to tip and you to fall.
That appointment is for Wednesday at 9:30.
You don't want to fall
I know
again.
you already been working with.
Make sure all handrails in your home are
They told
secure.
you what to expect
Special
for their
tools
program.
can make your daily activities easier. You may want to use things like a reacher, long hand sponge, sock aid, or long handled toe horn. And also, stop walking in
The
front of
program is
moving
gonna guide
vehicles.
him through recovery
Okay.
with monitored exercise.
Do you have any
with
questions
ECG
at this
monitoring,
moment?
Education, lifestyle changes.
No.
Do you guys have any?
So now we're going to have you do a teach back so we know if you remembered everything.
Yeah,
Okay.
can you tell me why you would need to call the
If I-
doctor?
Oh, signs.
I have a hip replacement, and I'm going to need to change some of my activities. I will have to keep my legs straight and not rotated in or out. I will sleep on my side with the affected leg and support my other leg with a pillow so they don't cross. If I am smelling any discharge from my wound, I will call my doctor because that's a sign of infection. I will take all my medication as directed, and if I have extreme pain, I will call the doctor and let him know.
What are you doing? Squatting on me? If I stand,
So, as I understand it, I won't be able to use my swing at the villages, and it might restrict some of my extracurricular activities in the dance room. And I will be very careful when I'm using my walker in front of cars.